All right. Well, thank you so much for joining us. My name is Jason Onesto. I'm the Assistant Director of New Student Programs here at the University of Richmond. We appreciate you joining us for our New Spider Summer Series. I think this is a series that we have for all of our incoming students and their families and supporters to help answer some questions about specific areas regarding information students need to know before they kind of come to the university. I'm going to allow Marianne to introduce herself before handing it off to our guests to introduce themselves in those areas. Marianne.
Hi, y'all. My name is Marianne Packer. I'm a recent graduate from the University of Richmond, and I'm now interning in the Office of New Student Programs. So excited to be here with y'all today.
I am Yanit Morton. I'm a program manager in the Office of Risk Management alongside my colleague Keisha Trim.
Thank you, Yanit. I'm Keisha Trim, Senior Director of Risk Management and Insurance.
And I am Dr. Sarah Terse, and I am the Medical Director of the Student Health Center, and I look forward to chatting with you all today.
Thank you all. Before we jump into content, just one little housekeeping item. You will notice at the bottom of your screen that there is a Q&A box. It's a little square with a question mark in the center. If you want to go ahead and submit any questions that you have throughout content delivery in this, utilizing that function, we will have some intentional time at the end of our content sharing to answer these questions. So as you have questions, I encourage you to submit them if you feel more comfortable writing them down and then asking them once we come to that Q&A portion of the webinar. You're more than welcome to do that as well. But without further ado, I'm going to go ahead and hand things off to our presenters, starting with Dr. Terse.
Thank you, Jason. So I'm going to share my screen here. Oh, I need to get your permission, it looks like.
Looks like you have access now.
Yes, thank you. Okay, so thank you all for coming today. My name again is Dr. Sarah Terse, and I am Medical Director of the Student Health Center. I am a general pediatrician by training and spent 10 years in general pediatrics prior to joining the University of Richmond as the Student Health Center Medical Director. The clinic is very well staffed with a great number of providers with vast experience. So we've got two medical doctors here that are board certified physicians and two nurse practitioners, also board certified, registered nurses, certified medical assistants. As I mentioned, I'm a pediatrician. We also have other providers with backgrounds in family medicine, women's health plus primary care specialists. So we have a really nice background here to help support the students at the University of Richmond. We are here to provide evaluation and treatment for illnesses and injuries, as well, and most acute things like things that happen in the moment. But we also do certainly assist with management of chronic health conditions. We love to provide health education to students, and then we can also provide some physical exams and preventative health care as well. We've been accredited by an organization called the AAAHC, the Accreditation Association for Ambulatory Healthcare. And I mention that because it's an organization that helps us maintain our high level of quality medical care. It makes us review every single year that we're up to date with the national standards policies for providing excellent healthcare. And we've been accredited by that organization since 2014. We, in the office, I mentioned we manage acute illnesses. So some examples are, I hurt my ankle, I have a sore throat. In the office, we can do point of care testing as you would expect from most healthcare clinics. So things like doing a strep test, a flu test, checking for a bladder infection. And so that's what we spend a lot of our time doing, just those things that come up from day to day. And then we also can also do blood work and work up students for more significant illnesses. And that can be drawn right here in the health center by one of the medical assistants or nurses. So that's phlebotomy services, and we can draw that here. I do want to make clear that is something that a student would need to see a provider for. Sometimes we do get asked to draw labs that another doctor has recommended. That's certainly something we'd consider, but we'd have to have a meeting with the student to understand what the needs are and what the labs are, so we know how to appropriately counsel and evaluate those things. We are located in the Wellbeing Center, which is right nearby the Robins Stadium. We are co-located with colleagues that are really supposed to be able to provide a one-stop shop for health and well-being. The health center is on the second floor of this building, and we have our counseling and psychological services office just one floor above us. We have a nice cafe and social area on the first floor, and then there's a little walkway right to the gym or the recreation center. So it's a great little resource for our students. So a little bit more details about our appointments and our fees and medication. So when you are a student at the University of Richmond, your healthcare appointments are provided at the Student Health Center. So there is no fee to be seen by a doctor or a nurse practitioner. We have scheduled appointment slots so that those can be scheduled online easily. And then students can also call to make an appointment. We have a same day availability. We have next day availability. We really work with the students around their schedule to make sure that they can be seen and taken care of. There, again, no charge to actually see a provider or a nurse to come in for that appointment and talk with somebody and have an evaluation, have a physical exam, receive a diagnosis, no charge. There are the tests that I mentioned that we can do, like the strep test, the flu tests, and immunizations. There are charges for those that are, I think a strep test is $5. And those are things that, we don't take payment at the time of the appointment, but they are charged and billed to the student account. So no payment is due at the time of the appointment, but there are some charges. We always discuss those charges with the student, so that's not something that is ever going to be a surprise, and they are part of that decision making, whether or not we are doing a test. We are not able to bill your medical insurance at the Student Health Center. We have set, prices for certain things that we can do here, and we do not participate with health insurance. But if that is something that we need and the student needs to be seen, needs to see someone outside the health center, and to be able to use their health insurance for some reason, there are many times where we can help coordinate that kind of care and help be a resource to help figure out how to do that. We can prescribe prescriptions. So student comes in, has a sore throat, positive for strep throat. We can send a prescription to a student's pharmacy of choice. And then we also have, University of Richmond has an off-campus shuttle that can provide transportation to several of the local pharmacies. There's even one that's in walking distance. So we really can provide, all of that information to the students at the time. So the clinic is open when school is in session from 8:30 a.m. until 4:30 p.m. That's Monday through Friday, with the exception of Thursday mornings. We do have staff meetings in the morning, so the clinic opens on Thursday mornings at 10 a.m. If the clinic is closed, which certainly happens all the time, something happens at 8 o'clock at night, 9 o'clock at night, students can always call the main number of the Student Health Center and speak with a nurse who is on call. And if the nurses need a doctor, they have an ability to contact one of us as well, or a nurse practitioner or a doctor. They can call us if they need us. But they're a great service, and they help advise students who need help when the clinic is closed. There are several urgent care options available close to campus if someone does need care. And again, that's something a lot of students will call the nurse line for. Like, is this something I need to address tonight, or is this something that I can take care of at the health center tomorrow? And they'll walk the student through that. And if they do need to see an urgent care, we have lists of those on our website, and that's information that we can share with them. So it is a good idea, for students who are coming to the University of Richmond, just to know about their health insurance and find out what services are in network options for them. So if there is a certain urgent care that is recommended by their insurance company, that's information that's good to know, when you're preparing to come to University of Richmond, but also just know how to look it up, because it might not come up in the first few months you're here, but it's something that you need to know how to do, is understand how to navigate your health insurance. Okay, so that's, the after hours call line. And then what if there's a true emergency, something where you need immediate help? We do have University of Richmond Police Department and Emergency Medical Services team. And the students can access that by calling 8911 on any phone. And that service is they're phenomenal. They're really at the student's side as quickly as they can be. When I've seen it happen here, it's, usually within minutes. And so students just, call, they provide their name, their location, the nature of the emergency, and they get immediate care. So that's the police department and the EMS will assist and determine if additional care is needed. So if transport to an emergency room is needed, or if it's something that they can help with right away. The Student Health Center has receives any report that is made about an emergency response, and it is part of our practice to always follow up with the student by the next business day to make sure that they're doing okay. So we, care a lot about making sure they feel cared for and checking in if they need any follow-up care. So as we talked about, we've got students with their acute conditions that we take care of, and then we have many students who have chronic medical conditions who need additional support. As I mentioned, I was a pediatrician in this area for 10 years. Some of the other providers in the office were also working in the community prior to coming to the University of Richmond. So we are really, really fortunate to have great on-campus resources and a lot of knowledge of the off-campus resources as well. So on campus, we've got the Student Health Center that can help manage chronic medical conditions within, whatever capabilities that we have here. We have our counseling and psychological services group that is upstairs for needs related to that. We have a close relationship with disability services for students who need accommodations with classes or transportation related to their medical conditions. And then we also have dietitians. So the resources on campus are excellent. And then, as I mentioned, the Richmond area has a great number of specialist providers and support providers as well. One thing, I really want to emphasize is if you are coming to college and you have a chronic medical condition, it's just really important to plan with your home provider about how to do that transition. So several students that we have with the chronic medical condition maintain communication and care with their home providers and have follow-up visits with those providers on school breaks. And we will still help at the University of Richmond as needed, but some students choose that path. Other students choose to establish care with a specialist in Richmond, and we can again help either way. We've spent a lot of time just really helping students set up where their care is going to be. But I really encourage students to come up with at least somewhat of a plan before you come here, because I find that that's helpful just to talk through that with your current providers. It's also, we really want to set you up for success. So just call or ask any questions too, if you have any specific questions about a specific illness or condition. The other thing we'll talk about is providing your health information. So I'm going to get to that on our official pre-entrance health forms. But I also think it's really good practice for students to take a moment to think about what is my diagnosis, what medications am I on, and write that information down and store it somewhere safe. Because in the moment when you're not feeling well and you're coming to the health center, you might not think of it all in that moment. But if you have it written down, you pull it out and we read it with you. You put it on your phone, you put it on a piece of paper that you put in your wallet. I really encourage you to go through that process so that we can help support you in the moment if you need anything. So as I mentioned, we do have pre-entrance health forms, and we follow at University of Richmond, we follow the guidelines for institutions of higher education based on the Code of Virginia. And so we do require the list of vaccines that you see here: tetanus, MMR, polio, meningitis, hepatitis B. And we do need to verify those vaccinations, as you enroll and get your forms due for entrance into the University of Richmond. So this is a two-step process. One is actually physically entering the vaccine dates on a tab in our portal, and the other is uploading a copy of your vaccine record. And you can see here when the forms are due. Those dates are important because if we do not get that information in, then it can lead to a hold, which can delay registering for classes for a subsequent semester. So we usually work this out, but it's just something that's important to know, to really understand the process so that we can get that information in and not delay, registering for classes in subsequent semesters. So this is what the form looks like. So your home provider can fill out this form and then submit the signed copy through the student portal. You can access the Student Health Center's site through the main website at www.richmond.edu. Scroll to the bottom, you'll find the Student Health Center. Then from there, you can click on the Student Health Portal and then enter your information for single sign-on at the portal. And then you can see this is how you navigate downloading forms, uploading the signed forms, entering immunizations. So that's, you can see here along this side is what you'll use to do that process. And then once students are here and utilizing the Student Health Center, use the same portal for when you are seen by a provider or a nurse. And if we can display your labs here after you've had labs done. We can give education about a diagnosis. We can summarize the visit. So this is the student health portal that you use for uploading your forms as well as managing your care while you're here. So next, I'd love to get to go back to Mary Ann and let Mary Ann tell us a little bit about the Student Health Center for her perspective. She can tell you a little bit more about it. She actually worked in the Student Health Center this past year, and I'll turn it over to her to tell you a little more about that.
Thank you, Dr. Terse. Hi again, everyone. So, as I mentioned, I'm a recent graduate from the University of Richmond, and during my time here, I studied biology and I was a pre-medical student. And so part of that meant that I wanted to gain some healthcare experience during my time here. And getting a job off campus at a healthcare location can be a little bit difficult because of the hours, but at the Student Health Center, they're only open during the time that students are on campus. So it's really convenient as a student. So I guess starting from that perspective as a student employee at the University of Richmond Student Health Center, I worked as a clinical assistant with my CNA, so my certified nursing assistant in the state of Virginia. But you can become a clinical assistant either with your CNA or your EMT license. And as a clinical assistant, I was first point of contact for my peers, students coming into the health center. We do have a policy. I never brought back anyone that I was friends with or I knew. So we do try to maintain that privacy for students. But I would bring back students and I would just take their vitals, so pretty basic care, and then I'd pass along the information to either one of our medical assistants or one of our RNs. And it was a great way for me to learn more about clinic flow and have those conversations with our amazing providers because we're all in the same workspace. So I was able to ask questions and learn a lot about the medical field through this position. So if that's something you're interested in or your student is interested in, I highly recommend just keeping that on your radar for future years and looking online to see if maybe there's a job posting for a clinical assistant role. And Dr. Terse already mentioned a lot of my little quick tips as a patient. But as a student, you can make your appointments online, but I would recommend calling the health center just because it's a little bit quicker. Sometimes we do hold appointments at the health center that might not show up online, like same day appointments. So it would be great to call the health center instead of looking online. And that phone number is just highlighted right here. So your student or you can put it into your phone. And then again, Dr. Terse already said, but I think it isn't well known that you can go to the university student health center even without having the university insurance at no cost. So I've gone before when I've had strep throat, as Dr. Terse used as an example, and I was able to get a prescription at no cost to me other than my cost of the prescription at the pharmacy. And on that note, as Dr. Terse also mentioned, we have a shuttle here at UR that goes to a variety of pharmacies, but one of the closer ones I've just highlighted here, it's the CVS off of 3 Chopped Road. And specifically also that pharmacy is within walking distance if someone were to be up to that. But if you're sick, I would probably recommend taking the bus. Thank you.
Thank you, Mary Ann. All right. So, summarizing, just a reminder, the Wellbeing Center is here to give the students a comprehensive approach to well-being. I mentioned we've got our counselors, we've got the gym, health promotion, disability services is not physically in the building, but they're right next door. It's amazing. As someone who has worked in the community and has children, I would be just so thrilled to have the resources here the University of Richmond offers. And we are all the providers in the health center are also really passionate about what we do and really excited to take care of the students. Really importantly, I know questions will come up. We'll have some time to answer some general questions at the end of the webinar, but while the clinic is closed to student appointments this summer, we have our team here working. So if you do have questions about your unique situation, please email the health center, call me, call the operations director. We have our nurse supervisor here. We are happy to answer your questions and talk about any specifics. We really encourage not sending like health records through email, like use the portal if you're actually uploading personal health information. But, we can discuss anything over the phone. So even if you just call and leave a message, so one of us will call back and discuss with you. So thank you so much.
Amazing. Thank you, Dr. Terse. As we shared at the beginning, if you want to go ahead and submit any questions that you may have from Dr. Terse's content, please utilize that Q&A function at the bottom of your screen. We will have more than enough time to answer these at the end. But to keep us moving forward, I'm going to hand things off to our representatives of the Office of Risk Management.
Thanks, Jason. I will go ahead and share my screen. I hope I am on here correctly. I think so. Can everybody see that? Okay. All right. So again, I am Yanit Morton. I work alongside Keisha Trim in the Office of Risk Management. And I just want to invite her at this time to jump in at any moment that you want to add to. Keisha's been doing this for a really long time, and I really want to make sure you guys get as much information as possible. So I want to just begin the SHIP, as we refer to it, Student Health Insurance Plan for this year, is the overview that I want to provide. Just want to start off here with some insurance requirements, and that always sounds like a heavy word. So we just want to make a little bit of a lighter situation just by letting you know that this is actually a requirement, if you will, for all degree-seeking traditional undergrad students. So essentially anybody that is a law student or a traditional undergrad, not School of Professional and Continuing Studies or the Graduate School for Business. This is tailored toward our undergrads and our law students, domestic students, and international. So our international students are actually automatically enrolled in the SHIP. The only exceptions would be handled directly through our administrator or the carrier site, and that would be if they have adequate coverage that meets the requirements for the Affordable Care Act here in the area. But essentially, they're automatically enrolled in the SHIP. There's no necessity for them to enroll in it. Domestic students, however, have an option of either enrolling if they don't have health insurance coverage through their parents or even on their own, or they can waive the SHIP if they do have adequate coverage that meets those requirements through the Affordable Care Act. Typically, our open enrollment starts around June, but this year we were able to get going on May the 18th, the portal opened to be able to waive or enroll. That enrollment period goes through until September the 4th. And once it's closed, the only way to enroll back into the program is if you have what they call a QLE, a qualifying life event. Either you lose coverage on your parents' insurance, or if you turn age 26, those would be some of the life events that would allow you to waive out of the plan. Notably, students who do not take action by that deadline of September 4th will be automatically enrolled in the plan sometime in late September. However, it is really strongly suggested that you go ahead and enroll as soon as possible, because the plan does, as on this timeline here, you can see open enrollment. Like I said, it typically starts in June, but opened in May of this year. The policy actually starts on August 1st. And so we encourage you to go ahead and enroll as soon as possible so that you have access to your ID cards. You can get into the portal. If you have any claims that come up or any situations where you do need care or to be seen, then at least you have all of that information at the very beginning, and you don't have to wait until you've been automatically enrolled. Just as a little caveat right now, the enrollment piece on the site is not active. We are still awaiting approval of the state rates. And so once that's done, our third party, our insurance administrator, which is Gallagher Student Health Insurance, they will send out another email to students to let them know that it is time to go ahead and enroll or that they have that option. But if you would like to go ahead and waive, meaning you have adequate insurance, go ahead and do that as soon as possible. Like I said, that is open for you to do so. If you look here on the timeline in July, I want to say, I think about mid-July, the fall ship fee will be added to the student accounts of those students who have not waived yet. You will see the fee show up in two installments. There'll be a fall one, there'll be a spring one that happens around the first part of December for the spring semester, just so that you're aware that it's not going to all be in one charge on your account. If you look down at the bottom here, this note that says important, if you do submit proof of your health insurance after the waiver deadline of September 4th, you would only be eligible, or you may only be eligible for a partial refund from the carrier. That is at their discretion, but that's another reason to go ahead and get enrolled or to waive as soon as possible for the August 1st deadline so that you have that covered. And then, sorry, I think my little screen's in the way here. And then the policy does end July the 31st of every year. And so that is our plan year. It's the 26-27 plan. This would be something that every year you would have to enroll in or waive. This is not something that is an automatic enrollment every year. It is something that you have to take action for every year. So we'll talk about now some of the plan design and the benefit options that you have. Just again, as an overview, the insurance company or carrier is United Healthcare. They are a preferred provider organization plan, meaning that you would not have to select a specific provider. You would be able to go visit your provider, a doctor in network, I'm sorry, and you would not need a referral for any specialized care. You would be able to use that preferred provider. It is really encouraged to use a doctor that's in network because, as you'll see later in the presentation, it really does help you save on costs. And I think it just helps for a smoother process as well, just depending on your circumstances. But to recap, the coverage period is August 1st of this year through July 31st of next year. As you can see here, the annual premium total is $2,540. However, it is billed, like I said, by semester, so $1,270 in the fall. And then again, in what we call the spring semester, but keep in mind that charge does occur on the student account as of early December. So when you see it, you'll know what that is. The rate applies to students, to their spouses, and then to their dependents. If it's going to be double the charge for two or more children, and so that's not something that continues to accumulate. Correct me if I'm wrong, Keisha, but once you go over the number of children being two, if that's your scenario, then that would just double that amount. So any of the costs that you would pay for dependents you would pay directly to the carrier. You would not have that come out of your student account here at the university. That would be something you would have to arrange to pay them directly for. Segueing into the benefit options here. For the medical care, this plan covers the preventative care, which includes things like immunizations, physicals, well woman exams, routine screenings, that sort of thing. Those are some things that you can have done at the Student Health Center, as Dr. Hurst said earlier, and so we do encourage you to do so, but you are more than welcome to see a provider off campus as well for that. This plan does provide for specialist care. Say you need to go to a dermatologist, that is something that you would be able to do. And again, because it's a preferred provider, and if you find a doctor that's in network, you could do so without a referral. The medical coverage also includes care for hospitalizations or surgeries, and then those telehealth medical appointments as well. For mental health care, similarly, telehealth visits are provided for or offered. Individual and group counseling sessions are covered. Inpatient and outpatient health treatment for mental health issues alongside substance abuse or substance use disorders are covered as well. Prescription medications are provided under the plan, as well as travel assistance. And with regard to travel assistance, this would be a scenario like if you were on vacation for a time period and you were more than 100 miles away from campus and you needed either evacuation or repatriation services. This is not something that would apply to study abroad. That's covered under a separate plan that the university has. Okay, so plan design, like with the plan design, you would basically have some places where you have some co-sharing components like deductibles, co-insurances, co-pays, prescriptions, and then some out-of-pocket costs. And so I'll kind of run through each one just as a general overview here so you can see what you may have responsibility for depending on what services you're having. A deductible is, if you're not familiar, the amount that you must pay for services before the plan begins to pay. Per person, if again you choose an in-network provider, that cost is going to be $250 for a deductible. If you were to choose a provider that is not in network, that is out of network, that's about $600 or $600 per year per person. Essentially, the co-insurance is the percentage that is covered after it covers the expenses paid after the deductible has been met for the plan. And so in this instance, the preferred providers network, if you chose a doctor in that network, the plan would pay 90% after the deductible is paid or met, which means you would have 10% to pay. And then if you look down a couple of bullet points here, just for context, the plan pays 100% of anything that's preventative care. So when we mentioned earlier things like well-woman visits or physicals, those are situations where the deductible does not apply, and you can go for some of those services to the student health center if it's more convenient for you. The plan also pays 100% of treatment at the student health center, so that's another incentive to use them first if you can. If you choose a provider that is out of network, then the co-insurance amount that the plan would pay would be 70%, meaning the student would pay 30% after the deductible. With co-pays, this is a fee that you pay for services rendered when you arrive for the services, or you get billed for them as you arrive for services. These are not subject to the deductible. So for instance, a physician's or office visit is $25 per visit. If you go to urgent care, that's $50 per visit. And emergency room visits are $150. So we do encourage that students, if it's an emergency, absolutely go to the emergency room. But if it's something that's more urgent care related that you need to go be seen for, it's just a consideration to make whether or not you can book an appointment with your physician or go to the Student Health Services Center first. Another portion of the financial responsibility for the students in this plan would be any prescription drugs or prescription medications. Again, if you are using a preferred provider and they write you a prescription and you're going to go to a pharmacy and they can offer you the generic form, that would be sort of the consideration for the tier 1. A generic drug, the copay is going to be the $10 copay. The tier 2 prescriptions or medications are more for brand name prescriptions. That copay is $20. And then tier 3 is more the specialty prescriptions or compound prescriptions, and those require a $40 copay. And again, as Marianne mentioned earlier, the CVS is located very close to campus. For compounds and things like that, you would be able to access prescription medication information on Gallagher's site to look up those doctors or those pharmacies that are in network for you. The out-of-pocket maximum means the most amount that you would pay out of pocket during the policy year. And that's those totals. So for an individual, it's $6,350. If you're choosing an in-network provider, $12,700 for your entire family if you have dependents on your spouse on your plan. So we do encourage you to look for doctors that are in network to save costs. There is no maximum if you choose a provider that is out of network, so it can really be quite astronomical depending on whether or not you have a significant illness or injury throughout the year. So that's something to take into consideration. I want to go into our voluntary plans a little bit here so that you know that there are some things that are available that don't require you to have the SHIP, the student health insurance plan. You can purchase these. They are standalone products. dental and vision. They are offered through a different insurance administrator called Ameritas. This is not United Healthcare, but you would go through Gallagher's site, our insurance administrator site, to be able to purchase these standalone products if you chose to. The voluntary dental insurance plans, there are 3 options available. They range, as you can see, from about $26 to $58 a month. And there are over 100 general dentists within the 5-mile radius on campus. So you have quite an offering of dentists to choose from for that care. The voluntary vision is, again, facilitated or administered by Ameritas, and there are 2 plan options available for the vision coverage. They range between $11 and $17 roughly a month. And there's also significant number of providers within 5 miles of campus. We have over 50 providers. But again, you would go to the GallagherStudent.com website and be able to enroll in these plans if you choose to. And that's something also that is not billed to the student account. It's something that you would pay the provider directly for. And moving on to our resources and contacts for you on campus. And so this is what you see on the screen right now is actually the SHIP website, or our student health insurance website. If you look toward the bottom here, it says studenthealthinsurance.richmond.edu. But if you don't want to type that many characters or just want a quicker way to remember how to go to it, it is ship.richmond.edu. Both will get you to the same location where we cover insurance requirements. The rates are listed. It talks about some of the benefit highlights. And we do have it linked to the insurance administrator, Gallagher's student health insurance website, so that you can enroll or waive. You can look up information that they have posted on their site. But again, we have some frequently asked questions and just some campus resources for you, and a link to waive or enroll that will take you to Gallagher's site as well. And this is sort of an overview quickly of Gallagher's student health website. You can view, again, their SHIP benefit information. You can enroll or waive. They also have a really great feature where you can look up those in-network doctors, hospitals, labs. You can review information about the prescription drug tiers to see where your prescriptions would fall. You can enroll, again, as we said earlier, in the dental or vision plans, and add dependents and set up your payments with them. But there's a wealth of information. There's some content there just for like best practices, student discounts that they offer, and those sorts of things. There's a help center as well if you'd like to search specific topics. And these are some contacts available. Again, this is, I'm Yanit Morton and my colleague Keisha Trim here. We work in the Office of Risk Management at U of R. We are your campus resource. We are the ones who manage the hard waiver process each year. We can also assist with things like if you go to log in to waive the insurance and something comes up to tell you that you're not maybe eligible or you need to be verified. Your eligibility needs to be verified as a student. Typically, it may have something to do with your student email address not being activated. And so we're able to kind of pinpoint those challenges up front so that you can go ahead and go onto Gallagher's site and enroll or waive. In the middle section, you can see here Gallagher Student Health is the administrator for our insurance, and the account manager's name there is Watson John Denis. You want to contact Watson for things like if you do have a QLE or a qualifying life event. Again, if you age out or somehow lose coverage on your parents' insurance. For international students, if you feel like you do meet the coverage requirements and you want to have an exception to that auto enrollment, or if you have specific claim assistance where you would like Watson to help you work with United Healthcare to get a claim resolved, those are things you want to reach out to Watson for. The United Healthcare customer service website is listed here on the right. That's where you want to go to look up find a provider information, the account that you create to be able to access all of this, the My Account assistance. They would be able to help you with password resets, that sort of thing, if you're logging in, if you need a pre-authorization for a certain treatment, or if you have specific claim questions, you want to go directly to United Healthcare's site to get their assistance with that. And I think that's all I have, but Keisha, if you could chime in, if you have something to add, I'd appreciate it. And if not, that's fine too.
Thanks, Yanid. I don't have
Thank
anything
you.
to add, but I see that we do have a couple of questions, so I'm sure Jason will get to that shortly.
I sure will. For that, what a great transition. We can go ahead and jump into our Q&A portion. Thank you so much, Yanni and Keisha. Appreciate you all. I think our first question that we have here, it says, do students need a full physical and dental exam before coming to campus or just immunizations and health history forms?
Yeah, so I'll answer that question. So we need the health information form and we need the immunization. So we don't require a specific type of exam from a doctor. I would say most doctors are going to require some kind of visit in order to fill that information out, but could have been something within the past year. It could be something they need from you now. But no, we don't require a specific physical exam.
Perfect. Our next question, what is the process in case our insurance changes? Can we then switch to the university's health plan? And if so, is that prorated?
Keisha, I don't know
Oh,
if you.
go ahead. Yeah, go ahead.
Yes, you can switch. The prorated is something that I will have to punt to Keisha because I want to be sure. I know that we've had some options before now, but yes, you want to enroll in the plan afterwards. That would certainly, depending on your circumstances, that will be a qualifying life event. If you, again, lose coverage, if you age out of your parents' plan, then yes, that is something that we could handle. But I want you to elaborate, if you can, Keisha, on the
Sure.
proration.
Sure. So, what you would do, as far as the process, you would reach out to the Gallagher Student Health Account Insurance Administrator, Watson Jean Denis. You would tell him the circumstances surrounding your need for insurance, so that he can verify and approve that QLE, and then he would get you added to the plan as of whatever date it should take effect. And it will be a prorated amount that he will then send that amount to the university. So say, this happens as of November 1st this year. You would be charged for coverage from November 1st through July 31st of the following year. And so he'll send the university that premium amount, and then we will give authorization to the bursar's office to add that charge to your account. So if you have a QLE, you can reach out. You don't have to pay anything right then and there either. It comes back through the university and your student tuition account.
Amazing. Thank you all. What other questions do we have? Usually, as soon as I start wrapping up content, we get an influx of questions. So we'll give it a few minutes just to let folks finish typing if they're typing, or maybe to collect some of their thoughts before they submit a question. Alrighty, well, I'm gonna go ahead and start offering my closing remarks. Thank you all for joining us today. If you're joining us for our next New Spider Summer Series webinar that we have following this, it's our second language proficiency webinar, so we look forward to seeing you then. However, if not, just a reminder that all of our New Spider Summer Series webinars are posted to our YouTube channel. So if for some reason you joined the call late, or maybe you would like to revisit some of the content of this presentation and any other ones in our series this far, you will be able to look that up at our New Spider YouTube page. Just look up New Spiders on YouTube. We'll pop right up. It's amazing. It's great. And we make sure that everything is posted in the way that it needs to. But thank you so much for joining us, both our attendees and then also all of our guests for sharing your content. We look forward to welcoming you in the fall. I hope you have a great rest of your time. Thank you all so much.